Hi there to the A&H Steel team. It's Dr. Bridget Sterling here. I'm the epidemiologist that worked with you guys last year, and I'm really pleased to be back to talk to you guys about vaccines. Now, some of you might be wondering, how is vaccines a workplace issue? Well, we're going to talk about that today and hopefully answer some of your questions, and hopefully you guys can have a chance to think about what vaccines are, to think about how vaccines are made for COVID, to reduce some of the confusion about information that's all out there on the internet and everywhere else about vaccines, and to empower everyone to make their own decisions because this is a personal decision, but it's a decision that affects others. So that's what we're going to do today. So I hope you guys can sit back and enjoy yourselves and have some fun. So let's think about where vaccines come from. You might be thinking that vaccines are quite new. Some people think that, oh, like how long has this been going on and what's happening? Well, the good news is vaccines are in no way new. In fact, they've been around for hundreds of years. So we have loads of experience with vaccines, but there are different kinds of vaccines. And I think what's really troubling people these days is the thought about what about these new vaccines and how are they working and where's this technology come from? So, if we want to go back a little ways in history just to think about where vaccines come from, they're actually before vaccination, there was something called variolation. Variolation was when people used to take some of the pus from some of those infectious sores that people had, and they would crush them down and the scabs down, and they would make it into kind of a powder and then mix it with a few other things. And then they would take it and blow it into the faces of kind of young, healthy people. That process was called variolation. And variolation has been around for 2,000 years, and there's lots of evidence of it being used in places like India. So we've had lots of experience with variolation for many, many years. Vaccination itself came from, and vaccination, the difference is that it's actually just injected into people. But the word vaccination itself comes from the Latin word vac, which is about cows. And the reason is because back in the 1700s, there was a doctor called Edward Jenner who decided to inject cowpox into a child, which is very unethical. Cowpox is not that harmful. And in fact, he noticed the reason he even thought about it was he noticed that milkmaids or little girls that grew up being milkmaids had beautiful skin because they never actually got pox. They never got smallpox because they got cowpox first. And so he thought he'd try it, an experiment on a child that had not had cowpox. So he gave the child cowpox, and then he took a needle and scratched the skin and put smallpox, which is terrible and deadly and disfiguring, into the child's bloodstream. And the child did not develop smallpox. So what they knew from that was that we could do something that would help people not get the disease. And that was called vaccination after the cows themselves. So, what is it that we are looking at when we talk about vaccines? So, the simplest definition would be that it's anything that stimulates your immune system to produce antibodies. And antibodies are the thing that your body makes whenever you have any kind of foreign object that shouldn't be there. So even if you have a cut or a sliver or something like that, your body will produce antibodies. And some of them are very specific and some of them are not specific. So when we want specific antibodies, it's because we want to be protected against a specific disease. So once a person is vaccinated, they develop immunity to that disease to whatever degree. And we hope that that happens without anybody having to have the disease first. And that's our expectation for vaccines. We want people to get vaccinated so that when they come in contact with the actual disease, they don't get sick. So, what is a vaccine? So, I mentioned antibodies before. The opposite of an antibody is an antigen. So, it's whatever that active component is, whether that's a weakened cell itself or weakened virus itself, or whether it's a different virus like what they gave Edward Jenner gave people with cowpox, or it could be just a piece of a virus, or it could be a protein in the shape of a virus. So there's lots of different ways that we've been for many, many years delivering antigens. And an antigen just is whatever it is that helps the body to create antibodies. So, along with those, in many vaccines, we have preservatives, and we've had some trouble with the preservatives over the years. The good news with the COVID vaccine is that none of them have any preservatives. The other thing that we've put in vaccines over time has been stabilizers. And again, we don't have stabilizers in these vaccines. Something else that people have had trouble with vaccines in the past are residuals. And what we mean by that is a lot of vaccines in the past, including the flu vaccine, have been grown in chicken eggs. And so in growing them in the chicken eggs, a little bit of the chicken egg protein would get into the vaccine, and when some people who are allergic to chicken eggs got that into their body would have a reaction. But that does not occur with the COVID vaccine because it's not made in chicken eggs. And dilutants is another thing. Well, Johnson & Johnson doesn't have any dilutants, nor does AstraZeneca and Moderna. But Pfizer does use a diluent, which is just a liquid to mix with the vaccine in order to get it prepared in order to put it into the dose in the needle. So that's just something that could be there and someone could be allergic to, but in this case, the dilutants are pretty much just water. So vaccines help people develop immunity to a virus or another germ. And basically, they just introduce a less harmful part of that germ or something created to look or behave like it into a person's body. And then it encourages the body's immune system to develop antibodies that fight the particular germ and keep that person from getting sick. Later, if the person encounters that germ again, their immune system can recognize it and remember how to fight it off. So some people might be asking, who regulates these vaccines? Like, where did they come from? And is it just the companies? Is it these drug companies that's regulating it? Well, not at all. Both in Canada, the US, and everywhere else in the world, countries have bodies that regulate who gets vaccines. So essentially in Canada, we have the Canadian Adverse Events Following Immunization Surveillance System, which is part of the Public Health Agency of Canada and Health Canada, which are constantly looking at, evaluating, thinking about, and changing what we do with vaccines. And that's true for childhood vaccines, it's true for flu vaccines, and it's certainly true for the COVID vaccine. So we have these bodies of people who are very good at looking for whether or not a vaccine gives you more benefit than harm. And we do recognize that there is sometimes harm that comes from vaccines. But this group of people are carefully monitoring and really assessing to make sure that there is more benefit to a greater degree than there would be any harm from these vaccines. So the Canadian Adverse Events System follows something called post-market vaccine safety. So they're looking in to see constantly, following up, looking at real-time reporting of any adverse effects. They identify any increase in the frequency of severity of any kind of reactions. So if there's suddenly an increase in reactions, they're going to look at that. And they're looking to see if there's something else they should be researching. And they have the capacity and the funds and the support in order to do that. So they are tasked with that job of making sure that vaccines are safer for the population than not having vaccines. So Health Canada closely monitors and reports on the number of vaccines that are given, the different demographic data, all adverse effects, and all serious adverse effects. And this is all publicly available data. So there is transparency within the Public Health Agency of Canada and Health Canada that they are allowing, openly showing the data, and you have access to it. So you can look and see what are the different effects that people are having, including serious effects, and what kind of people are having those effects. So one of the big questions, or one of the big areas, and certainly you guys talked about, is that maybe people will be concerned about the way that the vaccine was developed. And so that was one of the answers that you guys said that other people might be concerned about. And you said that about 77% of you said that. So they have concerns about negative effects was the highest number. 90% of you said that, 91% actually. And also you guys thought that people would be concerned about how it was made. So I want to tell you how it was made. So vaccines, this is how normally we have research and development and preclinical work for vaccines. So people say this came very quickly, and they may be correct. If we look at the different stages of vaccine development, this is they. And you can pause this and look at the details if you want. But the real crux of this is that there are normally 4 stages of vaccine development. The first one has about 100 or less volunteers and really answers the question, is the vaccine safe? Is there an immune response? Are there serious side effects, and what might the right dose be? And you saw, especially with AstraZeneca, there was a lot of question about what the right dose might be, and whether or not the timing needed to be what it needed to be, et cetera, et cetera. And this is what we would have spent 1 to 2 years figuring out had we taken a lot more time with this vaccine. And then stage 2, there are several hundred volunteers, and we answer the questions, are there side effects, and what are they? And how are the volunteers' immune systems responding? And normally we would look at this over a 2-year period. If we move on to stage 3, which again normally takes about 3 years, we would have thousands of volunteers. And we would answer the questions, how do people who get the vaccine compare to people who do not? We do randomized control trials. We actually have where even the people administering the vaccine wouldn't know whether they had a placebo or the actual vaccine. And we would ask the questions, is it safe? Is it effective? And what are the most common side effects? And lastly, we would have stage 4. And this is when vaccines are only licensed after we know they're safe, effective, and that the benefits outweigh the risks. And the vaccines are made in something called lots. And every lot is tested for purity and potency. And those lots are only released when they're tested. And Health Canada is in charge of this. And they make sure that this stage is followed and was certainly followed even for, of course, COVID-19. And this continues after licensure. So as you can see here, let's give it, a year and a half, 3 years and a half. So 6 years and a half for the whole process to have taken place under normal situations. So you might be saying to yourself, but it didn't take 6.5 years. We found out in January of 2020 about this disease. I guess they knew about it in December 2019. But all of a sudden, wow, we've got this vaccine, and, you're expecting us to take it within, a year and a bit. So what's going on? Well, the governments of the world agreed to a process that was much more accelerated than we would normally expect. And in the US, this was called Operation Warp Speed. And what they wanted to do was take all of the processes and run them simultaneously. So instead of having years of stage 1, stage 2, stage 3, they actually ran all 3 stages at the same time. And you can see how they did that here. And they also removed all of the financial, procedural, and logistical barriers. And I can tell you from experience, it is painful when you even have a product that is really, really great to go through the Health Canada situation, and just the bureaucracy that it takes is really what takes up a lot of the time, even with other medical devices and vaccines and such. So just so you know, this is not those years that are spent are not only spent in like peer research. A lot of the time is spent waiting for government approvals and trying to find the financing and working through some of the procedures. But maybe the most important thing for people to hear is that this vaccine, the vaccine for COVID, piggybacked on existing vaccine knowledge for SARS, Ebola, and MERS coronavirus. And I'll show you what I mean by that. So if you look in the research, so you can go to PubMed and you can look it up, you'll see over 10,000 hits for SARS and MERS vaccine. And this is between the years of 2005 and 2020. So remember we said it takes, 6-7 years to normally get through the stages of a vaccine. So we're actually talking about research that's going back 15 years. And that research was being done on the original SARS, it was being done on Ebola, and it was being done on MERS coronavirus. And MERS, which is the Middle Eastern Respiratory Syndrome coronavirus, is very similar to the virus that causes COVID, except that it kills more readily. So they went through the people that were already working on the MERS vaccine. When they got the genetic code for COVID, they were able to very quickly just switch out the spike protein code for COVID and the spike protein code for MERS. So they were able to piggyback on all of that research. And you also may have heard about the nanolipids that they've been using to deliver the vaccine. And those have been used for some time now in cancer therapy, and they've been used in other vaccines. And so it was not such a huge switch. It may be the first time that en masse we've used RNA, mRNA vaccines, but it is not the first time that it wasn't a short time that we've been in development for this. And so I hope that helps to clarify why this was able to be done in such a short time. It was because of cooperation. It was because governments removed barriers, but it was more importantly because we were already in development for a virus that's so incredibly similar to the one that we have. And in fact, switching out now to look at the new variants is actually very similar to what they did between MERS and SARS-CoV-2. So if you like, you can look. These are all freely available papers, and you can go and look yourself to see all of the research that has been done leading up to this time. So I mentioned mutations, and that is something that people are concerned about. You mentioned it in the survey that we did. A lot of people mentioned the concern about Delta variant, and you should be concerned. But what is it that causes mutations? Is this something that just happens over time? Is this a natural occurrence? Well, I can tell you that transmission is what causes mutations. Every time the virus passes between two people or between a person and an animal, we have mutations. SARS-CoV-2, the virus that causes COVID, when someone has that virus and we go and test their pets, we very often find that the pets also have antibodies, which means that the pets have also a past history of COVID. So dogs and cats get COVID, gorillas get COVID, minks get COVID, lots of animals do. So whenever it switches between people and animals or people and people, there are mutations, but that doesn't make a new variant, right? So transmission encourages mutations, and that's just mistakes that happen. And what happens is that when the virus goes into your body, it picks up little pieces of your genetic material as well. And so that's kind of a way that it moves from you, and it takes a little bit of you with it when it goes. But those aren't variants, those are mutations. Those are just little changes. But when there are a significant number of different mutations on the same part of the virus, what we end up with is a variant, and sometimes you heard it be called a variant of concern. And variants of concerns are ones that kind of take off and they get moving and they go through populations. And nowadays we start using all of these Greek letters. Say, well, it's Greek to me. Alpha, beta, gamma, right? Delta. And there is theta and epsilon, and I bet we'll get all the way down to omega. But there are lots of different variants that we're seeing. So if you ask yourself, well, what does this mean and why do we care? Well, the different variants act differently in people. So if we look way back to that Wuhan variant, when you had that Wuhan variant, one person could infect on average 2 people. So if we had one person come into A&H Steel who had that variant of COVID, then, 5 or 6 days later, we'd likely see 2 more people come down with the virus. And then 5 or 6 days later, we'd likely see two people for each of those 2 people come down with the variant. So now we have a further 4 people. And so now in our population, we'd have those 4 people plus those 2 people plus that one person. So we'd have 7 people with the virus. And then those 4 people would go on to infect. You see what's happening here. So exponential growth. So that was what was happening. And then there was another version that was going around Europe, and all of a sudden that one was hitting around a 3. So once it kind of changed. And then we started nailing down these as variants, and we called the alpha variant, the one that was discovered in the UK. And that one was able to infect between 4 and 5 people for everyone infected. And lastly, you can see that the Delta variant is leaning towards 8 people. It's highly, highly contagious. So it's as many as 3 times as contagious as the original virus. And that doesn't sound like that big a deal, but when we're talking about exponentials, it is huge. Because what that means, let's just take the lower number of 5, although I don't believe that's true, but let's pretend that that's true. And one person with Delta variant walks into A&H Steel. That one person is likely to infect 5 other people if, I mean, we're going to talk about in the absence of vaccines. And then those 5 other people would so 5 days later, after that person comes in, 5 other people are infected. And then 5 days after that, another 5 people for each of those 5. Now we suddenly have 26 people. So in a few generations, we could easily infect everybody. Now we're not going to, though. We're not going to because good news. Most people at A&H Steel are already vaccinated, and they're going to have some protection against it. So that's wonderful news. And we'll talk more about that in a minute. But why is this a big concern? Does that really make a difference? And if so, how does it make a difference in a population? Well, you can see it here. So India, this is India's data. India was doing really well. Nice flat curve there, looking really great. February, March, not many cases at all. And at that time, about less than 7% of all of the variants that were sequenced, that were tested, were Delta. So not many. But at that point, so say 5% were Delta variant. If you look by 2 months after that, what happened? We had a gigantic spike in the number of cases. If you look there, we're actually looking at hundreds of thousands of cases caused by a few cases of Delta variant. And that is what would be expected. And then, of course, they went into lockdown and they started mass vaccination and they started all kinds of mitigations and the number cooled off and went down. So we don't want a curve like that. That is not a flat curve. That's bad. So let's see what's happening in other parts of the world. So now we're looking at the UK, Indonesia, Russia, and South Africa, and really we see the exact same pattern. We see back in March when there was only a few cases of Delta variant, things went pretty well. And that was true for March, it was true for April, May. And then by the beginning of July or the end of June, all of a sudden we saw a higher percentage of Delta variant. And what did we see? We saw the numbers take off again. So we don't want to see this. We don't like the curve to look like this because that is going to be, well, it's going to result in people being sick, which we don't like, but it's also going to be massively hard on the healthcare system. And you saw that in India, you saw it in Iran, you saw it in Brazil, other places where the healthcare systems essentially collapsed. And there were even places in the UK where they just shut the doors of the hospitals and said, we cannot take anybody else. So we don't want to see that here. And we're not going to because we're getting vaccinated and we're going to stay vigilant. Now, Delta variant also looks different than the other variants that we've had in symptoms. So let's look at the symptoms, whether or not you've been vaccinated. So if you're unvaccinated and you get Delta variant, you're going to have a headache, sore throat, runny nose, fever, and persistent cough. But if you've already had one vaccine, look at what suddenly kind of runs up there. We start seeing more headache, runny nose, sore throat, sneezing, and persistent cough. And the sneezing is the thing that kind of comes in. You think, well, sneezing, we used to say if you're sneezing, you don't have COVID. Now we're not able to say that. And if you're fully vaccinated, this looks almost exactly like influenza, doesn't it? Headache, runny nose, sneezing, sore throat, loss of smell. So we're actually coming into, and the cough is actually dropped right off there. So when we're vaccinated, we might see different symptoms. And with Delta variant, we might see different symptoms. So we have to be vigilant and thoughtful about the things that we see. So now let's think about what we know about COVID-19 vaccine and these variants. So if we look at how effective these vaccines are at this point in time, and this particular study describes, and you're welcome to freeze the video and have a look in detail at this, but it describes both the AstraZeneca vaccine and the Pfizer vaccine. But if we look at these two particular vaccines in combination, so if we're looking at whether you had any vaccine, after one dose, you have almost a 50% chance of being immune. So that's pretty good to the Delta variant. And if you've had 2 doses, you have an 87.5% chance of being immune at that point. So that's good. You have high levels of antibodies, and we'll talk about waning in a minute. Waning is after time how you might have slightly less protection. But for now, this is pretty good. And one of the things I've been saying to people about this summer is that if you've been double vaccinated and a little bit of time has passed, and we can feel pretty good about our ability to do some things. So if you wanted to have, a picnic with your family, if you wanted to, hug your mom, if you wanted to, this is the time. This is the time because really this is the time when you have high levels of protection. And if that's really good for your mental health, then that might be the time to do things. Of course, you have to weigh all the risks with the benefits, but this is a good time for you to do some of the things you've wanted to do. And it may not be the time in a little bit, so we have to be thoughtful of that. But when we have vaccines, some people have said that we're concerned about adverse effects. That, as I mentioned, was about 90% of you said that some people are worried about that. And that's correct, that people are worried about that. But one of the things that the government is carefully monitoring, and again, that data is available to everybody, is adverse effects and medically important and serious effects, but even something called a safety signal. And this is when they're looking, they're really scouring the information that they're getting. They're getting information every day. And you can even go online and you can post if you've got to the government, if you feel you've had a reaction, you should tell your doctor, but you can also say you forgot to do that, you just thought you want to do it later, you can also post that to Health Canada and they're interested in that. So everyone is very interested in this idea of safety when it comes to vaccines and being transparent and the information just being out there for everyone to see. So I had a look at you guys and how you did with the vaccine and where you're at right now and what you said you had been doing. So when I looked at your results, I was really, really impressed. So if I look at your results, only 10% of you said that you had not been vaccinated at all. So I am really impressed by that. So that means that 90% of people that answered either didn't want to answer, just a couple people, or had either one and intended to get the second one or 2 vaccines. So I am really, really impressed with that. And so I think it was about 78% had both vaccines. 79% had both vaccines. That is really good. So well done, A&H Steel. So for the people that filled out the survey and what they reported, then you are above not only the Alberta average, which is 64%, but also obviously the that was the population who've received at least 1 dose, but you are also over the Canadian level, which is 59% as of August 1st, had received both vaccines. So well done. Well done, A&H Steel. That's fantastic. If we look at how many people of all of those vaccines, and that's just a really high number of vaccines, we only had in all of Canada 0.006% of all doses administered, resulting in some kind of serious side effects. And 137 of those people had anaphylaxis, which is a serious and life-threatening allergy. And that is a big deal. But I'll tell you what, when you are finished getting your vaccine, you know what they make you do, right? You have to sit there for some time. You think, well, this is annoying. But the reason is anaphylaxis normally happens in that time period. And they do have another section where people who normally or have had in the past an anaphylactic reaction even have to wait longer. We want to watch them to make sure they're not having an allergic reaction. And those allergic reactions, if they're not treated, can be deadly. But those allergic reactions, when treated, are not. And so we can follow up and make sure that somebody is taken to hospital and followed up with, and we can monitor them for safety. Another issue that people have had, and it absolutely has been a major problem, has been blood clots. And yes, blood clots are a specific concern for people who have had vaccines for COVID. But again, blood clots are largely reversible. Sometimes they are not. And of course, we have seen cases very rarely result in death, and it is terrible. And even one death is terrible. So the question then becomes, are the benefits outweighing the risk? And that is a question that the government asks on a regular basis. But at the same time, one thing that people should know is that their blood clots, if we know about them, are largely reversible. So if you have these symptoms, of course, we need to go and get help. And there are medications and surgeries and different interventions normally that we can do. But of course, if we don't know about it, then that's going to be a problem. So with reactions, we also want to recognize that, and I spoke to the WHO about this over a year ago, it was that we needed to be thoughtful about articulating or speaking about what's called a coincidental event. And what I mean by that is we will expect with every vaccine, because your body creating antibodies causes muscle aches, fever, headaches, and joint pain. That's actually the good thing that your body's doing. Whenever your body is creating a defense, that's what happens. But of course, as we said, there are rarely some serious reactions. But people naturally also have many health challenges, and some will naturally fall ill on days when people have vaccines. And what I mean by that is, even in the absence of vaccines, someone in America has a heart attack every 40 seconds. So if we're going to vaccinate 70% of the population of North America, and there's going to be hundreds of millions of people being vaccinated, some of those people are going to have heart attacks as a coincidence in the time around the situation. There's also something called the white coat effect, where people, when they're around doctors and nurses, actually get nervous and their blood pressure rises. So it's possible that some of those things might be being caused by the stress of the event, or even moving or waiting, or that kind of thing. But again, someone in America does die of a heart attack every 40 seconds, and every 4 minutes, someone dies of a stroke. And about 8 in every 1,000 people have regular seizures, and certainly people who have seizures more often have them when they're stressed. So some of the reactions that we're seeing may or may not be directly related. So what epidemiologists like me are looking for is excess death and disability. So we don't just look at what is, we look at what is that is more than what we would expect on any given day. And that is being monitored extremely closely right now. So, of course, blood clots are a concern with or without vaccines. In Canada, 2 people in every 1,000 experience blood clots each year. So it is not an uncommon event, but it is something to be concerned about and watch for, to know the signs and symptoms of, and to get help if people feel like they might have something like that happening. So I wanted to also give an example of risk and benefit. So there are risks with vaccines. There are risks with every medical intervention. But there are risks with COVID vaccines. But there's also a risk of driving to the COVID vaccine center, right? So if you were going to drive down to the COVID vaccine center, there's a risk, a very, very, very small risk that you may be killed on your way. And so if we look at the death rate following a COVID vaccine, not necessarily caused by it, but somebody happening to die, we look at everyone who dies within 72 hours of any kind of event like this, then we know the death rate. So if you were to live more than 10 miles from the vaccine center, it's likely that you would be killed, more likely that you'd be killed traveling to and from your appointment than you would as a result of the vaccine. So we need to put all of this in perspective. If because of COVID, you weren't able to travel this year on a long trip, you weren't able to go to South America or to Europe or Asia, and you normally would have, the risk of flying and getting a blood clot is much higher than your risk of having a vaccine and getting a blood clot. So these are all things to look at when we're thinking about risk. And I also wanted to just mention quietly, and not to get people excited about it, but one of the questions I asked you was about getting a booster shot. And the reason for that is it is entirely likely. I can say not with any authority that it will happen, but I can say it is likely that we are going to be asked to get booster shots in the future. And one of the reasons for that is because we know that antibodies wane. These very specific antibodies that we have for COVID, they are not as effective 6 months out as they were a couple of weeks after we had the shot. So this is the data that we have. And in fact, if you look at the AstraZeneca efficacy, after you first get it, you have about 62% protection. But after 48 days, so a month and a half later, you actually only have 50% protection. It doesn't take long with AstraZeneca to lose some of those antibodies. But it's also true for Pfizer and Moderna. So we can see there how we are going to lose some of the effectiveness. And that's when I mentioned if there's stuff you want to do and you want to get out and do something that you maybe hadn't done, this might be a good time for it. Not to take silly risks, but just to recognize that you do have some good protection if you've been double vaccinated against COVID. Some people have some concerns about unfair distribution, and I want to agree with you on that if that's your concern. And so I do agree that it's unfair that some people have had more access to the vaccine than others. But I just want to reassure you that by you being vaccinated, say that you have family in another country that isn't getting access to the vaccine, your not being vaccinated and say solidarity with them is not helpful to them. Because as I said, transmission creates mutation, which creates new variants. So if you want to protect your friends and family, and even people you don't know in, say, Ethiopia right now, how do we protect them? By ourselves getting vaccinated. So it isn't a selfish thing to be vaccinated. It's actually a helpful one. And remember that the Canadian government, for each of our vaccines, is contributing to COVAX, which is a way of giving vaccines to other countries. So just hold that in your heart. And I appreciate that some people do have that concern. Another concern that some people have related to human rights as well is the concern about using aborted fetal cells. And unfortunately, they did use aborted fetal cells in some of the creation of some of the vaccines. And so the Johnson & Johnson and AstraZeneca vaccines do use human fetal cell lines from a very old abortion back in 1985 in the development of their vaccine, but there's no cells that end up in the syringe. So it is used in the development, but not in the syringe. However, with Pfizer and Moderna, there are no fetal cell lines being used in the production of it or in any part of it. So there may have been early on when they were doing some testing, there may have been fetal cell lines used then. But any of the production and any of the vaccine itself is free of any fetal cell line. It's not necessary to use it. They don't use, that's not part of the process. So if this is your concern, then you can rest assured, maybe you may decide not to get the other ones, but you might decide then to get the mRNA ones. And I also want to just point out that Medicago, which is a Canadian vaccine company, is coming out with a vegan a vaccine right from the beginning, totally vegan, made in plant cells, etc., etc. And that's going to be hopefully approved in the next little while. So we can be looking forward to that if that's you and that's a concern that you have. Some of you may have had some poor past experiences with vaccines. As I mentioned, some people are allergic to egg. Well, good news. There's no egg used in any of the production of any of the COVID vaccines. They don't use any live virus. So some people are like, oh, what if I get COVID from? You cannot get it from there. This is not possible. None of them contain thimerosal. So that was a preservative that was used in vaccines some time ago. And people were concerned that it may have some connection to autism or other things. That is not the case. The needle is very thin. So those people that are concerned about the fear of needles and upset about that, it really is barely perceptible if you are relaxed. If you get all nervous and, feeling tense and that sort of thing, then it might not be. And I would recommend if that's you and you have a fear of needles, please talk to your physician or nurse practitioner about that, because there are things that can be done. A person can come to your home and give you the vaccine there, or you could have some medication potentially before having it, or in the case that my daughter has an extreme fear of needles, they very kindly had a section off to the side in the vaccine center where she went both times and had her vaccine there. So I was very thankful that they accommodated her so nicely. So please talk to your physician about it and see if there's something that can be done. So we mentioned the global initiatives, we mentioned the variants, we mentioned the waning protection and the hesitancy people have for lots of different reasons. Some people might be concerned about cost, like cost to the government or cost that sort of thing. That could be, but it doesn't help to not take it because the vaccine would then just go to waste. And we talked about timing as well, and that this may be, if you had double vaccine, a good time to do things. So there are some challenges, we recognize that, but there are also so many wonderful benefits. And I hope that you guys continue to just listen to the people in authority over you. It is a personal choice, but you're wonderfully helping your workplace by being vaccinated, and I just applaud you for that. I just want to point out too, and I asked you questions about this, but Alberta Health Services also recommends several adult vaccines. And I know there's some folks that are also in BC, like me, and certainly WorkSafe BC has some recommendations, as does the BC government, around adult vaccines that are exactly the same. But if you're in Alberta and you want to look that up, to immunizealberta.ca, you can see a full list. But I just wanted to point out, because you work in the steel industry, that I would love to see everybody be protected against tetanus, especially. And not many of you said you were. And so I just had a little bit of a concern with that. So maybe speak to your doctor about whether you should be getting the tetanus shot. And tetanus is awful, painful muscle stiffness, and it has this like lockjaw thing, so your jaw gets all stiff, and it can be fatal. In fact, tetanus, unfortunately, for those who have been diagnosed in the US, about 30% have died. So, of those people in the US that get tetanus, about 30% die. So, most people, though, step on a nail, or their skin is broken on metal, which is what causes it. A bacteria that's prevalent on metal breaks the skin. But most people have been vaccinated, so they don't have to. But we need a booster every 10 years. So make sure that you are up to date on your vaccines for that. And there are other ones there, including the influenza vaccine. And the reason we want people to have the flu shot every year is because flu, like COVID, likes to change it up. And we would really love to see people be vaccinated against the flu because, first of all, it's going to look an awful lot like Delta variant this year, let's be honest. But also, we want to make sure that you're vaccinated because really flu can also be deadly and hurt people. Maybe not so much you because you're young and healthy, but maybe somebody you know who has a chronic disease, is a child, is pregnant, or is elderly. And that usually starts in October or November, and you will see that coming up this year again. So if you wanted to ask the question, but does it all matter? Does vaccination really matter? Does it affect our population? It absolutely does. I work overseas in countries that are unable to vaccinate, especially for things like childhood vaccines. And I have seen many cases of people becoming deaf from measles, meningitis, other things, reaching infertility because of it. And if you look at these two graphs here, it takes us back to 1950. And you can see we used to have lots of cases of things like rubella and measles, and then we got vaccination, and lo and behold, now we don't. So it works. It's a good thing to do, and we protect not only ourselves but others when we get vaccinated. I just wanted, before we go, give you just a few encouragements and why it matters what you do. Because you might say, well, again, just why is this a workplace issue? What is this concern in my workplace? It actually is for a number of reasons, and we'll talk about that. The first thing is that you might be young and healthy and think, if I get it, I get it, and who cares? But the benefits of having a vaccine depend on a number of things that may not be true for your family members. It may not be true for other people working beside you. And one of the concerns that people mentioned in the survey was that they were worried. They had some concerns about coming back because they were worried about their colleagues maybe not being vaccinated. Well, if the survey is any representation of the whole company, I think people can rest assured that there is a high level of vaccination. So that's a good thing. But here's what matters when we look at vaccination benefits. It depends on your underlying health. So if somebody has an underlying disease or high BMI or low fitness level or is pregnant, then they may be more susceptible to vaccine preventative diseases. Age absolutely matters. So whether somebody is very old or very young may matter as far as preventing effects of a disease. Lifestyle is important, right? So people coming and going will depend on whether a vaccine is helpful for them, and their occupation, as we mentioned too. So for yourself, you may say, well, my halo is quite low. I am healthy, I'm young, I have a good, healthy lifestyle, I don't see too many people, and I work in an occupation that doesn't put me at high risk. But the thing is that it may not be you, but it might be somebody that you come into contact with on a regular basis. Somebody in your family may have a different halo. And so we get vaccinated not just for ourselves, but for other people because they may be more vulnerable than us. The other thing you hear talked about a lot is herd immunity. And essentially what that means is that we know that cows get coronavirus. They actually do. And so when you go to vaccinate a herd of cows, let's put us back in 2018 now, we go to vaccinate our herd of cows. We don't have to vaccinate every single cow. We only have to vaccinate a proportion of them so that if a sick cow comes into contact with them, the whole herd doesn't get lost. And that's essentially what we do. So we have a number in mind in a human population that says that if we can get vaccination up to 70% or 80%, then we feel like it doesn't really matter what comes at us. We're not going to get super sick from this, and we're going to be okay. And so that's why you hear that the government might be saying we're trying to reach herd immunity, we're trying to get to a 70 or 80% level of immunity. And you can reach immunity either from vaccination or from getting the virus. That Delta variant transmits very, very quickly. So if you're not vaccinated, your chances of getting the Delta variant of COVID are very high. So that's why we're saying no, we would like people to be vaccinated so that so that the virus just can't get going in our population. So that's what herd immunity is. And we've already mentioned variants. So we know that variants come from transmission, and we need to reduce as much as possible that transmission. So we're doing this for other people. We're doing it to help the world, essentially, not have these new variants, which we really can't anticipate what those new variants would look like. And of course, we're protecting our healthcare system. When we looked at those graphs of India and of the UK and other countries, we could see that there was a really scary amount of virus just recently in the last wave that could have caused a collapse of the healthcare systems and in some cases did. But we also see, and here's where the UK was rolling out their vaccine before that, a really amazing dip in cases, in hospital admissions, and in death. So that's a really encouraging thing to remember, that the vaccine works not only to prevent cases, but also hospitalizations and death. And as I mentioned, we're protecting the vulnerable. We might not do it for our friends, but every one of us has some kind of a family member or friend or colleague or clients that we work with or anybody else, somebody that we socialize with or travel with, that has some kind of vulnerability, whether it's so that they have their elderly mother living with them, that they have a disabled child, or that they have a comorbidity, whatever it is. Somebody that we work with, that we're in contact with, is vulnerable. And that's why it's so good that most of you have gotten vaccinated. So the question then becomes, and I get this a lot, what's the way out of the epidemic? How am I going to get out of this? We all want to go back to a sense of normal life, and it's coming. If we think about how we got out of the HIV epidemic, there was never like a beginning and an end. It kind of came on, and then we learned how to get better treatments. We learned how to live with it. We changed our behavior, and we now can live with HIV without being afraid of it, but just recognizing it, respecting that we don't want to get it, and working with each other to keep each other safe. And that's the same thing that's going to be with COVID as well. So we're going to need a combination of wide-scale testing and screening and vaccination and revaccination, but we're going to work together and keep our behavior change going. We're not going to be too close together indoors unnecessarily, and we're going to make sure we got good ventilation going through and barriers. We're going to keep cleaning and all those good things that we were doing before. So we'll keep doing all those things because we want to keep being safe. So I think we met our objectives. We outlined what vaccines were. We explained how COVID vaccines were made. I hope I reduced some of the confusion about information that's not backed up from science. And I hope that you're now empowered to make accurate information. I want to also say, A&H Steel, that I was incredibly impressed with the results of the survey that we did. One of the things I want to say is that 100% of you felt that A&H Steel either met or exceeded your expectations of them during this pandemic, and I think that's absolutely fantastic. From what you reported, you have higher rates of vaccination than the province or the country, and you have also said that you have intentions that seem to me to be very good about becoming advocates and encouraging one another in your mitigation behaviors and also in your vaccination. So those of you who had some concerns about coming back, I hope that's helpful to you to know that the company as a whole seems to be really in touch with what they need to do and listening to public health authority and science as we move forward together. I hope this has been helpful to you, and I look forward to answering any questions that you might have when we meet together.